While we're talking about types of crackdowns, or at least attempted crackdowns, we then have to talk about the Supreme Court blocking a ban on mail-order abortion pills, at least for now. Because this new ruling, it's subject to change in just as soon as maybe a week or so. And all of this is stemming from a case out of Louisiana because the state previously sued the FDA, arguing that its policy allowing people to receive mifepristone by mail, it violates its near-total abortion ban. And what you ended up seeing last Friday is that a federal appeals court sided with Louisiana. They blocked mail orders of abortion pills, and that ruling said, every abortion facilitated by FDA's actions cancels Louisiana's ban on medical abortions and undermines its policy that every unborn child is a human being from the moment of conception and is therefore a legal person. But as you could imagine, that decision was incredibly controversial. You even had the AP calling it the biggest jolt to abortion policy in the US since Roe v. Wade was overturned, especially since there's actually very little precedent for a federal court to overrule scientific regulations of the FDA, which first allowed people to obtain abortion medication via telehealth during the COVID pandemic in 2020, and they finalized that rule in 2023. So over the weekend, you had drug manufacturers taking the issue to the Supreme Court, asking them to reverse this ban and reinstate the ability to get mifepristone via mail and telehealth. And you had DeFranco Laboratories arguing that the decision injects immediate confusion and upheaval into highly time-sensitive medical decisions. And you had Gen BioPro calling it an unfounded and baseless attack on an essential medication. And all of that turned into this morning, the Supreme Court temporarily restoring mail access to those pills. But if you support that they did that, do not get too excited. Because the court, they didn't just overnight become a bunch of pro-choice liberals that all of a sudden care about women. Just as Samuel Alito, he simply put the lower court's ruling on pause until May 11. And so that way, the court has more time to consider its next steps and weigh the emergency appeals. And also ordering the parties in the case to file responses by Thursday. So while you have places like Planned Parenthood supporting this temporary decision, they still condemned the legal traps that continue to restrict abortion access. And you had their president, Alexis McGill Johnson, saying, while mifepristone access returns to where it was on Friday morning, the whiplash and chaos that patients and providers are navigating have already had consequences for people's lives and futures. Because this notably, it comes as medication abortion's been under a string of attacks from courts, lawmakers, and more. Right in March, for example, Senator Josh Hawley introduced legislation that would effectively ban the abortion pill, calling it a safety issue. But there, you immediately had reproductive experts noting that the science that Hawley cited when pushing for this is highly questionable at best. Because mifepristone is approved for use in nearly 100 countries, and there are 4 decades of peer-reviewed research that have proven it to be safe. And also, just to get technical and specific, while mifepristone is specifically the drug getting caught up in all these legal battles, it's actually used with a second drug called misoprostol. And when those two are used together, they're 93 to 99% effective at completing medication abortion. But ultimately, while we wait to see what happens with the Supreme Court, we really shouldn't be surprised. But it makes sense that Republicans are taking aim at this. It's the most common method of abortion. If you can chip away at access to the pill, you chip away at abortion access overall. And these telehealth prescriptions of mifepristone have been especially crucial for access since Roe v. Wade was overturned. In fact, earlier this year, there was a study that found that there were over 1.1 million abortions in the United States in 2025, meaning that numbers were essentially unchanged from 2024 and actually marked the highest number of abortions provided since 2009. Very notably, travel across state lines from those who live in abortion ban states, it decreased between 2024 and 2025, while telehealth prescriptions to states with bans increased. And there you have many noting that shield laws, which blue states have passed to protect healthcare providers who prescribe those drugs to out-of-state patients, have helped the boost. And so you've got the Guttmacher Institute saying, telehealth across state lines has played an increasingly critical role in ensuring access to abortion care in a national landscape where many states have total bans or other restrictive policies. And saying extending shield laws to telehealth provision is vital to ensuring that patients can continue to access that care they need, especially if they live in states with total abortion bans. Well, the court, it's actually upheld mifepristone access before. What comes next here, that's unclear. And it's one that we have to keep eyes on because it really could determine the future of reproductive care access in this country.